Hello and good afternoon. And yes, I am contracted in Texas, California, Nevada, um, and I think I'm still contracted in Florida. I have to take a look if they want me to do some extra web CEs. So sure. I'll do that. Medicare is for people who are generally turning age 65 and over. You had to have worked in this country for 10 years, a total of 40 quarters over the course of your um, of your working life. So, yeah. Let me know if you have any questions about Medicare plans. They're very different in different markets across the United States. So, and I'm contracted with many different companies, not countries. So, yeah. Uh, It's and some of them are HMOs, some are PPOs, some are national PPOs, some are regional PPOs, and then there's also plans called Medicare supplement plans, which anyone new to Medicare cannot enroll in Plan F anymore. So you can enroll in Plan G, which has the Part B deductible, which is generally about $200 per year. That's not a bad deductible, much less than mine. So in group health. Group health is a little bit different, as everyone knows, in their people that have worked in corporations and, well, any company basically offers a group health plan. And so you're used to having a network and a network of doctors and hospitals. And where do you get your tests done? That has to all be done in network, or you will be paying a lot more for, yeah. So this is just for the United States of America. And also, there's the issue of, I know that there is some question about national healthcare plans, and I'm in different forums and I see people writing in, oh, my mum, MUM, my mum, needs some help, and I can tell, and then they later let on that they are from England, which has the national healthcare system, which people are generally not too happy with, because it takes several months to get in to see a doctor. And then it also can take, and then several weeks after that to get the test results. And then even further after that, it takes that a longer amount of time for people to get those test results explained. So it's just a very long process, and I appreciate what they have here in the United States is individual health plans, and you can go from one to another at certain periods of times. They're called special enrollment periods. But so national health care, yeah, that's a great debate. I just know from people who are from other countries can get very frustrated with obtaining care and just with obtaining care. And of course the taxes need to be paid for that. So Um, so yeah, um, and we just recently moved to Houston, Texas. So, which has been it's been okay. It's an adjustment, certainly during a pandemic, when yeah. So it's been very interesting. So if anyone has any questions about Medicare or even Social Security and what's the interplay between Social Security and Medicare, um, I just had some clients call me last week and they had gotten their annual letter, their annual notice from Social Security detailing all the information about their Medicare information was also on there, and of course there was deductions, and that's the way Medicare works. Medicare and Social Security are just two peas in a very similar pod. So I just said to them, send it to me. Send me the letter. So that's what and I reviewed it and I said, well, and since they are new to Medicare and have recently been employed, what a lot of people don't know in that situation is that they have a look at the Medicare has a look back period, and it's called IRMA, Income Related Monthly Adjustment Amount. Yes, isn't that a nice way of saying, yeah, we fully appreciate that you have worked your entire lives up until age 65 or even further. I enrolled one woman, she was a nurse and she was 72 and she was still working, and thankfully very healthy, and I thought that was great. Um, so yeah, so the IRMA can add in an extra couple $100 per month, and doesn't go away for another year or two or three at a time. So IRMA is definitely something to consider if you are making a decent salary and then you retire. That can definitely impact you in the Medicare world. Um, so, well, thank you for watching.